VCS started in 1977 when Dr. Fitzgerald and I were finishing fellowship. And Dr. Kemp, who had been the cath director at the cath lab at MCV, came into private practice. And Dr. William Holland came back from Norfolk. He'd worked at MCV previously with Dr. Kemp. And I went with a multi-specialty group for several years where I'd been moonlighting. And Fitzgerald and Holland and Kemp formed Virginia Cardiology.
Eric was a pioneer in cardiac catheterization, starting with procedures at the VA and subsequently switching over to MCV. Bill worked with him and went to Norfolk. The two of them decided to go into private practice. I was finishing fellowship. They asked me to join them as a junior partner, and that was a wonderful opportunity for me.
I started here in 1980. I'd been in a multi-specialty group and was asked to join. They wanted a fourth, and I was familiar with St. Mary's Hospital and helped sort of became the St. Mary's wing. We were Virginia Cardiology to start with, and we gained several people over every year or two or three. And Dr. Cross joined us about that time, and Dr. Evans and Newton.
I trained with Gan at Fitz and also trained under Dr. Kemp. I graduated in 1978. I formed a LLC with Dr. Joseph Zawara, and we started at Retreat Hospital as a cardiopulmonary specialist. We did extremely well, we thought. And in 1994, Dr. Steve Cross called me and suggested maybe our group should think about merging, and we did. And that's how Virginia Cardiovascular Specialists came about.
As cardiology has expanded over the years, there's a lot of subspecialties. I think VCS is tremendously lucky to have excellent representatives in all the subspecialties. They're here early, they stay late, and they take care of the folks and get the job done.
If you want excellent care from your physicians, I think this is the place to come. We have an excellent reputation in the central Virginia area, from Tappahannock down to the southern part of the state, whether it's electrical or whether it's peripheral or whether it's carotid or heart disease. I think we have the expertise to take care of the problem.
There is a real emphasis on taking care of the individual patient here.
Many of the other large cardiovascular practices merged, have been bought out, or have become part of other systems. We have managed to stay independent, which I think allows us to provide better care.
VCS will strive to maintain its independence, and excellence in quality care will flow from that.